You so much for being with us, and congratulations.
Thank you so much.
This
Hi,
is
thank you
cool.
for having me.
Yeah, this is very cool. You were diagnosed actually with ADHD while you were in the Army. You're working to shine a light on mental health issues, but obviously there are other problems among those who've served, including illnesses related to trauma. Do you think this is an underreported problem with our troops?
I think it's an underreported problem because we are seeing people talk more about the stigma that exists around mental health care within the military. But I think that we still need to see that cultural shift that we haven't yet. The military community is very insular. We're a very tight-knit community, but we also have a difficulty meeting up with the rest of society. So we're culturally about 5 to 10 years behind the civilian population. And so even though in the civilian sector, we're seeing people talk about mental health care and say that it's okay to receive help, we're still not seeing service members receive that same care. And so we want not just leaders, but also soldiers to truly understand that as future leaders, it's okay to receive care, it's okay to ask for help, and it's okay to receive treatment.
Yeah, and what do you think needs to be done to communicate that the stigma shouldn't exist?
I think part of it is, again, that cultural change. And it's also teaching the next generation of soldiers. I don't think of myself as a specialist necessarily. I think of myself as a future leader. And because of that thought process, I try to instill that in all of my soldiers as well, and all the soldiers that I meet, because ultimately when you're in the Army and you're an enlisted soldier, our job or our purpose is to become a non-commissioned officer, in which case you'll be leading soldiers. And when we start now by changing that culture and by saying to ourselves, okay, well, I want to support my soldiers receiving mental health care, then as we move up the ranks and we become higher ranking and we have more soldiers under us, that helps to change the overall culture and also ensures that more soldiers are able to receive that care.
Okay, let's do a little game here of us pretending that you are on the Miss America stage and I'm the host with the microphone with all the glitter. And I am going to ask you a question about if you are crowned Miss America, how will you use your platform?
Well, I wanted to not just speak about mental health care. I want to also get legislation passed that will ensure that service members are able to receive care anonymously so that they don't have to worry about their chain of command accessing their medical records. And I would also, want to talk to veterans themselves, thank them for their service, and ensure that the VA is doing what they need to provide those services. Because we see it as a pipeline. We want to make sure that service members are receiving preventative, proactive care, because then when veterans receive the same care in the VA, that ensures that we prevent suicides, both from service members and veterans. So it's a preventative issue, and it's also a way that we can, continue caring for our military community in ways that most people don't think about.
Maura Spence-Carroll, you did excellent at answering that question. Thank you so much for your time. I know you'll do a great job on stage as you compete for Miss America, and continued good work. Thank you, and we salute you today.
Thank you so much, and happy Veterans Day.
Thank you. Well, we still have so much to tell you about at the top of the hour. It's Morning in America. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.